Congratulations on your nomination. Thank you for being here today.
Thank you.
As many of our colleagues have already noted, you will play a most important role, if confirmed, in helping to stabilize the individual market while Congress does repeal the law and repair the damage it has caused and enacts the reforms I believe, will put our health care system back on track. Now, in my home state of Kansas, we have 3 insurance carriers left. We feel very fortunate we have 3, with each individual only having access to 2 of those. And our premiums rose this past year over 30%. Down the road, it's going to be more difficult if we don't do something. There's no doubt with regard to uncertainty and angst among consumers. I think it's important to make clear that even if Congress and the incoming administration were to do nothing, let it go, just like in Frozen, let it go. And amending or repealing parts of the Affordable Health Care Act, the law is not working. And we have to do something to meet that obligation. The prices are unaffordable, markets nearly non-existent, with few or no options in several states and counties. We're not as rural as Wyoming, but we are rural in my state of Kansas. I have a concern back in the day when we sat in this committee and wrote the first version of the Affordable Health Care Act. I don't know where that mark is today. It's sitting on a shelf somewhere. But we went day and night and day and night and day and night, and I was worried about something I called the rationers. I'm talking about the Independent Payment Advisory Board, IPAB, the Centers for Medicare and Medicaid Innovation, CIMI, that's a wonderful acronym, and the new coverage authorities given to the U.S. Preventive Services Task Force, and I would also mention the Patient Center Outcomes Research Institute, which is called PCORI. Not many people are aware of these. I even went to the floor of the Senate and had 4 people riding a horse and called them the 4 horses of regulatory apocalypse. But I'm worried about it and the provisions which could interrupt the doctor-patient relationship, allowing the government to dictate what coverage you can receive. Can you share some of any concerns that you have with regards to these, what I would call 4 rationers, with all due respect of what they're trying to do with good intent?
Yeah, I appreciate that, Senator. I think that it's imperative that as we move forward, that we recognize again that the patient ought to be at the center of this, and anything that gets in the way of the patient and their families and physicians making the decisions about what kind of health care they desire we ought not go down that road. And so, for example, the CMMI, the Center for Medicare and Medicaid Innovation, I'm a strong, as I've mentioned, strong proponent and advocate for innovation. But I've seen in certain instances what's coming out of CMMI is a desire to require certain kinds of treatment for certain disease entities that may or may not be in the best interest of the patient. And because it carries the full force of the federal government and the payment for those services, it means that we're answering the question, who decides about what kind of care patients receive, by saying that the answer to that ought to be Washington, D.C., and I simply reject that that's where those decisions ought to be made.
I appreciate that answer. I have the privilege of being a member of this committee, the Finance Committee, and especially being chairman of the always powerful Senate Agriculture Committee. I'm particularly interested in HHS and, more importantly, FDA's work on food and nutrition policy. During the previous administration, the FDA issued numerous regulations with limited or delayed guidance and unrealistic compliance dates. This was the case with the implementation of the Food Safety Modernization Act, called FSMA, and more recently with the Nutrition Facts Panel revision. I know we all share the goal of a safe food supply and availability of accurate information for consumers, but I'm concerned the administration has not clearly or consistently communicated with the food and agriculture industry regarding new or changing requirements. Will you commit to working with the Secretary of Agriculture and other relevant agencies, not to mention the committee I serve on and similar in the House, that your department is issuing science-based guidance and taking into consideration other regulatory burdens when establishing compliance and dates, engaging in other regulatory actions.
Yes, I believe that's not only imperative, but the science that's relied upon ought to be transparent and available to the public so that people can see exactly what was the basis for the decisions that were being made.
Under the previous administration, we have seen increased activity and regulatory action on nutrition policies, such as issuing voluntary guidance. Yet the same administration continued to request additional resources from Congress to comply with statutory requirements under the Food Safety Modernization Act. I'm concerned that the administration did not prioritize FDA's mission to protect our nation's food supply, instead focusing on nutrition policies. If confirmed, can you discuss how you will focus on the core FDA duties, such as implementing the law that Congress passed, rather than agenda-driven nutrition policy guidelines?
Yeah, this is really important, Senator. And if I'm confirmed and given the privilege of leading, I would work specifically with the FDA Commissioner and make certain that we are relying on science, that it's science that is guiding the decisions that we're making, and again, that the transparency is available for folks so that they can see what kind of decisions are made and how they're being made. In addition to working with policymakers, you know best what's going on in your state and how it's being affected by the rules and regulations that are coming down from Washington in so many areas, but certainly in the agricultural arena. And so we ought to be having a dialogue with every single individual who has an interest to make certain that we're addressing the needs appropriately.
I thank you for your response. Thank you, Mr. Chair.